Assalamu alaikum. We have just recorded a case where the patient had rocking in the denture, and we talked about this one. So just if you go in the same date, you will find the video. But this is the second time of application. So what have you done? You thinned out the impression material.
Did good border molding.
Good border molding. What else?
And we apply closed mouth technique. We apply closed mouth.
Did you remove the overextensions that were present here?
Yes.
Now this is the second application. Okay. So see how it spread out the fitting of the denture. It's better. Okay. It thinned out, but still the pressure area on the socket is still there. There is a pressure area on the ridge anterior to the socket. Now, areas that have anterior inside the sulcus. Now, it's no longer on the rugae area, so?
Yes.
It's over the crest of the ridge now, the pressure points. Yes. Now, these, we don't look only for overextensions. I'm going to let you, by your finger, palpate them, and anything that is rough, you're going to remove the tip of it. Okay? So you're going to scan with your finger, lightly touching the fitting surface in these areas. You're going to color them first. Remove the rubber, and then with your finger touch them. If anything is sharp, you're going to remove the tip, as we have done with the rugae area. But other than that, do you know what I'm going to let you do? Although it's on the crest, I'm going to let you check the occlusion.
Yes.
Okay? In this case, I would suspect that there are heavy spots on the occlusion, and the occlusion is anterior, it's not on the posterior teeth. And this also is a reason for crestal overpressure and pain. Okay? It's also part of the instability. If I keep pressing anterior, definitely the posterior area will be ill-fitting, especially if I have any flexibility in the ridge. For example, a flabby ridge or a thick keratinized ridge. It will be pressed anteriorly. This will dislodge posteriorly. So the bite, guiding the bite, more posterior, will solve most of the crestal problem. But that doesn't mean I might find that there are some sharp areas that have folds, areas of recent extraction areas, roughness from recent extractions. Maybe irregularities in the impression while you're removing it from the patient's mouth, drags or whatever. So all of these might be causes, but anyway, after I'm going to remove the material, I'm going to color them first, the exposed areas. I'm going to let you palpate them with your finger to check for heavy spots. Definitely the socket on the left, I'm going to let you do it, this one. I'm going to let you remove from it. And we're going to see the occlusion, okay? So in a video later on, we're going to check the occlusion. I'm going to show you how the occlusion is distributed on the teeth, okay? Other than that, so that's the fitting surface. Going to the border, is are any of the areas overextended? Yes. Now, so look at laterally, because you added material buccally, now I could say you have a thick area on the patient's left side, okay? So this is thickness. It's not overextension, because look occlusally, it's not removed. The material has been wiped away from the side. That means this is a thickness issue, okay? So it's close to the coronide. Now this one, I could see it from above. Also, it's on the side more. So it's a bit of overextension and thickness, okay? Going anteriorly. So we have the area in the premaxilla area, in the sulcus, anterior sulcus. Now this is overextended. It's more a thickness rather than height. Okay. The frenum itself, I'm not going to depend on this. I'm going to let you do the one we do usually in my videos, where I'm going to let you stretch down the frenum, then insert the denture. The denture should not allow for any movement in the frenum. You have a lot of details of that in other videos, okay? I'm going to the side, nothing overextended. Here I have an area that is thick, okay? Look at the side, it's thick, okay? It's all thickness, it's on the side. A little bit overextension just on the frenum area, on the buccal frenum. This is from above, I could see it from above. Yes. Other than that, we're going to trim from the side, okay? Like a diagonal. We're going to put the bear on the surface diagonally, okay? Posteriorly, did you let him swallow and say ah?
Yes.
Yes, let us look at it. A little bit overextended in the hamner notch, 2 dots only, okay? In the middle, did you extend the material on the middle?
Yes, I did.
I don't see it beyond the area that's exposed. So I'm going to leave this for now, and we do it in the second time, okay? So remove the areas I told you to remove. Check for roughness on the fitting surface, and we're going to go for occlusion. You might see the occlusion and distribution later on, okay?